we found that there were a number of cases, for example, at President's College. But then, the regional task force that we have, as they've been testing in other dormitories, we have found positive cases. Once we identify a positive child, there are two options. If they came in from very far away, their parents were informed, so that the team in that location can do contact tracing and inform those persons who might have been in contact with that child. And of course, to inform the family about the status of the child. That child, if they couldn't go back home, because let's say they're from the interior, we then provided facilities, and in the case of Region 4, we have been able to bring them to the Diamond Isolation Facility, where they would stay for the duration of 10 days. Most of the cases that we have identified so far with students, they're all mild cases, well, not even mild, but asymptomatic cases, because mild would imply that they have some fever or some other signs or symptoms. All the cases that we've had so far are really asymptomatic, and we only knew that they were positive because we actually did the PCR tests. And so we are monitoring. There are a few students who their parents have opted to take them back home, and we have allowed for that because in our discussions with those parents, we have given them the option of either the child going to an institutional isolation facility, or they can go back home and, of course, observe the guidelines that we have given to them. So I think since we have started this exercise, we've had, I would say, about 32 children that we've identified, but they've all been looked after, and they're all being monitored.